the information was not shared across the systems. So if we had a liaison to actually link each system, which is going to be the medical home model, I'm pretty sure, because it speaks to the overall philosophy of systems of care. All the systems, they have to be talking to one another. In the Deja situation, unfortunately, they weren't, and the foster parents went to the hospital and they didn't have the knowledge that they needed to actually provide for her care in regards to her asthmatic history.
And imagine if a child presents on one side of town and all of their medical records, and that family has no information. What are they always asking in the ER? Are you allergic to something? Well, you don't know. So if I have a foster child that I only been in my custody maybe the last 30 days, and I can't get a hold of my worker, and I don't recall, and I don't have those medical records, so they didn't get sent to me in time because it was an emergency placement. You get my feeling? So my goodness, what can happen in a situation like that? So those are systems issues. Absolutely, those are systems issues. Anybody else? I'm going to pick on a few folks. Deja was eligible for, well, right here.
These places were maybe the first stop shop or something for some of these families, and I feel like the whole family doesn't get assessed. The 7-year-old wasn't assessed, the 2-year-old wasn't assessed in the previous one, and who knows if these families will touch another service again in any time soon. So the preventative services are not put into place. Even for the mom, this is their first port of entry, and I think all of the family itself as a whole needs to be assessed.
Thank you. Because if we say a whole child approach, the child fits in the concentric circle that's really important, and that's the family. And in order for that child to be nurtured, to thrive, to bloom, then we need to see what's going on with that family and how we can support that family as well, primary as well as extended.
I think that's a systems problem as well, though, because I don't believe that a lot of the private insurance really covers families. It really covers individuals. So if a family comes together for an appointment, usually the appointment is identified for a particular individual. So if you identify things with other ones in the family, they would need to be able to have a service identified for that other person.
Right. So, or even on a systems level, if a program takes the responsibility of assessing that family, the question is, will they be reimbursed? And if they've identified some interventions, because I am the child provider, but there's a need for support for the teenager or for grandmom or someone else, the question is, who pays for that? Whose client is it then? Jeanette, we have one person over here, then we'll come right back to you.
I was thinking too with the case with Denasia, the assumption was that the parents use the emergency because that's the only thing they know. I know in a situation with myself, the doctors tell you they use the emergency because of lack of access, because there's no way, with one incident with my daughter, she would have saw the doctor unless she went through the emergency room. And even today, they tell me anytime this problem come through the emergency room. That's the only way they're going to see her within 3 months.
Is it considered an acute issue?
It's an acute issue. No. You can make an appointment and get in, but the way their system is set up, you can't get in for 3 months. It's something she needs to be seen within a week, but nothing that day.
Okay.
Well, there's a public perception of that too. The advertising you see from hospitals around here is go to the emergency room. We're the fastest. We're the best.
We'll tweak you and let you know when it's time for you to come up.
And this is like a very expensive way to get medical care.
Okay.
Just one thing regarding the systems problem. In doing Medicaid outreach, we found that there was a father who had a heart attack and did not have insurance, but the system did not think to take an application on the whole family. And once we insisted that they did, it turned out that the kids were eligible, which made the whole family eligible. Now that bill got covered for the hospital. So making sure that you do assess the whole family is very, very important.
Excellent point. So assessment is obviously looking at emotional issues, social issues, but rather than a penalty to the family, the same way we want to talk a little bit about what's going on economically, if we present ourselves that we can be a resource for them and we want to partner with them about accessing services, then we may be able to get more information. Because everybody wants to give that financial information. Okay? Any other points before we move to some summary? Was there a need for child care in any of these settings? These are just a couple questions.
Yes.
Okay? Monica, do we have a problem with childcare and childcare slots in Detroit and Wayne County?
Absolutely. Unfortunately, there's been so many businesses that closed.
Hi. Yes, there is a problem with in our community, there have been so many businesses that have closed that the demand is not there to meet the supply. And yes, when there are instances where parents need to take care of serious situations, it can be distracting, it can be irritating because you have to take everyone with you, and sometimes you feel it's overwhelming. Therefore, you won't do it, even though the child may need it. And so it can be a really barrier to the success of the family, whether it's health or other issues connecting to WIC or anything like that.
First Children's Finance is working with Skillman and many other providers to help be a vehicle like Great Start to talk about quality and have access for more slots for quality child care. It's a major issue throughout the country and certainly in our own backyard. Going up the age group, someone, I think Deja was about to be referred to which program? Early on. And I'm just right now, we'll come right back. I just want to make sure that we're touching on do we all know what those programs are? Because so often we come together and we walk away and say, I heard them say something. What is early on? Anyone here can speak to that? Any one of our many providers in the room who can share a little bit about what early on is? Okay, early on, grew out of, okay, I'll go there, what was called IDEA, the Individuals with Disabilities Education Act. And recognize that there are children who may not be impaired developmentally, but who could be at risk, or if we don't provide them with a little bit more attention, they are going to become special ed. So early on was developed here in Wayne, and throughout Michigan and throughout the United States. The particular model was focused on children from birth to age 3. So if children are presenting themselves where they appear to be a little bit delay in either language, maybe some hearing, it could be their speaking, any number of things, even their eye-hand coordination, they can be referred for an assessment. And early on exists in many of our community mental health agencies. Primarily the door for early on is through Wayne RESA, the Wayne Regional Educational Services Administration. And there's, once they go into early on, and we've worked with this with Dr. Teresa Holtrip, who is a medical director for Wayne CHAP, we're trying to make sure that once a referral goes out, information comes back in. Because, you know, we have a tendency to do that, don't we? We make a referral, and who knows what happens. And then Fawn, there was something else, and I wanted to come back to, I know, Jack, you wanted to share something. Fawn, was something you wanted to share?
I was just saying about the 7-year-old and the 2-year-old. Sometimes if the 7-year-old is not paying enough attention, there can become abuse between the siblings. If you don't diagnose that there's an issue going on with the other child, if the children.
Sure. Sibling rivalry is a known fact that exists, and all of us have expressed it and experienced it, right? And I think many of you in the audience probably heard someone say, and hold your horses there, because I got a good laugh. All of us went back, yeah, my dad used to say the same thing. So sibling rivalry is a normative pattern in growth and development in families, but we know it can escalate to something else quite differently. Jason?
Thank you, ma'am. I forgot to mention, in regards to Deja's situation, it sounds like she's going to be a future community mental health case getting connected to community mental health services through one of our many providers in Wayne County. I think it was very beneficial that all of the doctors were very knowledgeable of all the community resources. However, I think it would be extremely helpful if there were brochures, pamphlets, literature in the doctor's offices or in the patient waiting areas, because we've all been to these hospitals and clinics, and we usually see the high blood pressure brochure, have you had a stroke brochure, diabetes brochure. We see that, but we don't see anything about mental health, how to connect to community mental health services. Where can parents get assistance in regards to advocacy? Where can the youth get involved? Where can the youth get advocacy from? We don't have any literature like that in the doctor's office. So if the physicians assistants, doctors, nurses had that information readily available, they can also give them some tangible object that they can read later when they're not distracted and overwhelmed by all the information that they're getting at that point in time.
Because it's not just about physical health, it's also responding to health and wellness is a state of mind as much as anything else. Sue?
I think it's a little deeper than that, because we've discussed the fact that as medical people, we're not real comfortable with the mental health piece. And that doesn't start just when you get into practice. This goes back to when you're in school.
Yes.
Do we focus in on that when physicians are being trained? Do we make sure that they understand and become as comfortable with mental health as they are with physical health? And I know as a nurse, my psych training was like this, my physical health training was like this. We had very little training on how to deal with patients in the totality. And I think we need to go back to the education piece, because we're not going to see it down the stream unless we do.
Okay. So you brought up a huge issue, which is our professional development. We're trained in our silos, aren't we? So, okay, the physicians are over here, the nurses are over there, the social workers are over there, the early
Schools
kids
are over
schools
there.
are over there. And so somebody starts saying we should collaborate. Well, I don't even know who you are besides, what's your degree here? So we go there with each other, don't we? And so we don't even have a predisposition to be multidisciplinary. If we're not multidisciplinary, it's even harder for us to begin to think about different sectors, because the reality is that we have such really hard walls that exist between us. I asked, one of the reasons I thought it was very important for Jack to be with us, amongst many reasons, is because what we're talking about is what we can change ourselves. That's one part of our conversation. You know, what can I do differently as a social worker? What can I do differently as a DHS worker? What can I do differently as a parent? What can I do differently when I'm sitting in the waiting room, and how can I help educate and support my community? But the other part of it is we want to lift up what are our programmatic and what are some of our systems issues. Because now we may have some opportunity to start communicating some of that. And I'd like for Jack to kind of talk a little bit about the role of Michigan's children, and then we want to get from you, what are some things that we can make some recommendations around?
Well, Michigan's Children is an independent advocacy organization, so we don't take government money, which gives us some credibility when we go to the legislature and try to educate them on the best practices and the best ways that our children can thrive. We don't want our children to reach adulthood and not be able to hold down a job, not have a good education, not be healthy. It's just going to snowball into worse situations for our taxpayers when those adults become a strain on our system. Healthcare reform is coming, whether we are ready for it or not. And the one thing I like about Governor Snyder is that he is preparing the state, attempting to prepare the state for the massive changes in healthcare that are going to take place in 2014, including an insurance exchange in Michigan that will help people connect with various health insurance options and plans. But he's got a tough row to hoe with his own party, who think that, first of all, they don't want anything to do with Obamacare. They don't want to spend any tax dollars on things that actually help real people. They just want to cut taxes and cut services and go back to the days when everyone's kind of fending for themselves. So what can you do about that? What should we be doing? First of all, you have to understand the issues. Now, this room is full of experts. You're an expert in your particular field, medical care or education or even DHS. And you have a voice. Each of you has a representative in the House. You have a senator in the Senate. We have a congressional delegation. Can I ask I don't want to embarrass anybody, but who knows the name of their state senator in this room? Some do, many don't. Who knows your congressional representative, House of Representatives? In this area, it's still Dingle, although they're changing the lines based on the elections the last time around in the census. And a lot of the people of color are kind of lumped in with a bunch of Caucasians now in districts, or will soon be. And so if people of color don't speak up and use their voices,